So why, as a liver transplant surgeon, would I take on hepatitis B? And the reason is, in my view, hepatitis B is the most neglected global public health problem in the world. When do you ever hear about hepatitis B in the newspaper, on television? But it is actually one of the major causes of death in the world. And also it has touched the lives of many Asian families as well as Asian American families. We call hepatitis B a silent killer. Why? Because without a blood test for hepatitis B, you won't even know whether you are infected because there are no symptoms until it is too late when you develop advanced liver disease or liver cancer. Without testing and treatment, every year between 900,000 people to 1 million people die from liver cancer or liver cirrhosis caused by hepatitis B. So as a transplant surgeon, how many lives could I save every year? But there's a very simple public health solution to this. To end this epidemic by first vaccinating people so they don't get infected. Secondly, by testing and treatment so they don't need a liver transplant and so they won't die from liver disease and liver cancer. So 22 years ago, shortly after I moved to Stanford, I founded the Asian Liver Center to address the disproportionately high prevalence of chronic hepatitis B and liver cancer in Asians and in Asian American community. And also to address the gaps in awareness, the gaps in research, as well as the gaps in national policies on prevention, testing, and treatment. So I'm very happy to report that our efforts are helping to make a difference. There's very encouraging progress in China, where we have actually been very active for the last 15 years. Why? Because China has the largest burden of chronic hepatitis B and liver cancer in the world. Through our advocacy, collaborations with health departments, both in the national and provincial level, collaborations with the World Health Organization, and our very large-scale donor-supported demonstration projects, we have actually led to increased political commitment and financing in prevention and more recently in treatment, as well as laws that ban hepatitis B discrimination, which is pervasive in many parts of Asia. In this country, it's estimated that only a fraction of the people with chronic hepatitis B have been diagnosed, and most of them are foreign-born. As a result of our advocacy, research, and collaboration with the Centers for Disease Control and Department of Health, routine hepatitis B testing for Asian Americans as well as foreign-born from many other countries is now both recommended and also covered by every health plan, including Medicare and Medicaid. And hepatitis B vaccine is also covered for every American who wants to be protected against hepatitis B. And for the first time, the United Nations issued a call to action to combat hepatitis B in the Sustainable Development Goals. We really tried very hard to change the wording from combat to eliminate. But nevertheless, that led to the World Health Organization issued a global health sector strategy to increase prevention, testing, and treatment with the goal of eliminating hepatitis B as a public health problem by 2030. There is never a better time than now to scale up hepatitis B treatment. The reason is drug cost for treatment of hepatitis B, which was prohibitive a few years ago, has dropped to less than 10 cents a day in most countries in Asia and Africa. So why are so many people still becoming infected and die from hepatitis B each year? The major reasons are lack of political commitment, lack of funding, and lack of awareness about the seriousness and prevalence of hepatitis B and the linkage to liver cancer. So to increase awareness, we borrowed a page from HIV and launched the Jade Ribbon or Join Jade campaign, using the jade color as a symbol to unite people worldwide to eliminate hepatitis B and liver cancer. We picked the color, the jade color, because jade represents good luck and good health in many cultures. And frankly, the other reason is because most of the other colors were taken. So I'd like to thank Asia Society again for this honor. I hope many of you will also join JADE, and I would like to invite the corporations that are present today to join our Join JADE employer initiative to raise awareness and protect your workforce from hepatitis B and liver cancer. Your support and charitable contributions to our center, as well as to our local partners like San Francisco Hep B Free, as well as our global partners at the World Health Organization regional and country office, is very much needed to help to end this epidemic, which has devastated the families and taken the lives of so many people in the world. If we fail to act to increase testing and treatment, I'm afraid in the next 10 years, another 12 million people will die from this preventable and treatable disease. Thank you very much.